I always say my plate is always full. I take one day at a time, one step at a time. I try to prioritize and organize as much as I can. And with that, it just seems to flow. I always seem to have a full and busy plate.
Up your back, crack up your, hey, oh, in St. Thomas, Virgin Islands.
I am originally from Florida, Hollywood, Florida to be exact. I am 47 years old. I'm a mother of 5 children, ages 31, 27, 23, 21, and 5. I am a business owner, entrepreneur. I'm also a doctorate student. I have been in healthcare for 25 years now, where I'm a nurse practitioner. I have my own practice and primary care for the last 4 years. I focus mainly on sexual wellness, primary care, and I consider myself to be very active and busy. In my off time, believe it or not, I like to go fishing. The water, it's peaceful for me, it's calming. I also do get the adrenaline when I do catch the fish on the hook. And I also like to listen to music. I am a I call myself guru. I listen to all types of music, all genres of music. My worst symptom that I experienced was the actual extreme fatigue and just feeling like life was at the end. Like I just couldn't do anything else. I started to feel very down, very tired all the time, very feeling of just can never get enough sleep or just never could be organized enough. And, it came to attention when I was talking to someone one day and, sharing my symptoms. So even before going to the doctor, I just felt it was due to my life of school, family, work, just being overwhelmed, and my plate is always full because anytime I would ever, talk about it, everyone's saying you always have a lot going on. So I always just chumped it up to I have a lot going on. Never thinking that it could have been something medical or that hormonal or anything like that. I was having the irritability, just tired all the time, the mood swings, not wanting to deal with people, and just the overall of I just need to sleep all the time. And when it was time to go to work, I wanted to get to work, do what I had to do, leave. Private life, I would want to get whatever needed to be done and go to sleep. Deal with whatever it is that had to be dealt with at the time and sleep.
My name is Dr. Angelo Gousse, and I'm a board-certified urologist and urogynecologist, and I specialize in sexual dysfunction, in bladder control issues, and reconstructive urology.
My first appointment with Dr. Gousse, I came in. It really was an assessment and evaluation. I completed paperwork that asked a ton of questions of what my symptoms were. I was very open, I was very honest, because I felt like if I needed to get the right help, I needed to be very open and honest about, what I was feeling. So I filled out the paperwork. Upon speaking with him, I explained to him I had, extreme fatigue. I felt extremely depressed. I was tired all the time. I had brain fog. I had a low libido. I explained all of those things to him. And given that I am a still menstruating woman, he gave me my options to say, you can have either this treatment or you can have that treatment. And we discussed what would be the best treatment plan for me. And we went from there.
Bethany has been struggling with several challenges. One of them is recurrent urinary tract infections. Around the time of menopause, in the perimenopausal period in a woman's life, not only the testosterone is dropping, but also the estrogen is dropping at the same time. And estrogen comes to compound the problem with various other sets of issues, many of them related to what is called the genitourinary tract, and that includes not only the vaginal canal, the vaginal tissues, but also the urethra where the tube comes out, the tube where the urine comes out. And this tube becomes, let's call it a little bit unstable, doesn't function normally. So many of these patients are predisposed to urinary tract infections or even recurrent urinary tract infections because of the lack of estrogen in the genitalia around inside of the vagina. So a lot of women wonder why now they're getting older, they started having urinary tract infection, whereas when they were younger, they didn't have that. And also she has some issues with emotional situations, which were, in my opinion, related to her perimenopausal state that she started going into. And I thought all these were issues that she was struggling with.
So the mental health aspect of anything is utmost important because we don't have our mental clarity, we don't have our mental sharpness, we're really unable to function. And you know, sometimes we go through life and we're just existing, but are we purposeful with the existing? So that's where I felt it's like I'm going, and I'm running in a circle. What Dr. Gousse explained to me was as we age in life, whether even I'm in my 40s, but even women in their 30s, our bodies tend to decrease the amount of either estrogen that we make. As women, we don't make testosterone, but it does help improve with overall symptoms of all the symptoms that I was feeling. In course, when we're having these decrease in hormones, we tend to have these symptoms, not knowing that the hormones play a part in the symptoms that we feel. So with that, we replace those hormones and then we improve our symptoms and we improve quality of life.
Well, it was felt that, you know, eventually one of her issues was testosterone deficiency. A lot of people don't realize that women need testosterone sometimes to resolve some of their very critical issues that are associated with perimenopause or even menopause. The testosterone itself is really a byproduct of the estrogen. And a lot of people don't realize that from a molecular standpoint, there's a lot of similarities chemically. Both of them are steroids, for instance. The way the chemical organic structures are very similar between estrogen and testosterone. So it's like some of the estrogen, if you will, gets converted to testosterone in the female, and this is what gives them the testosterone. But if the primary product, such as the estrogen, is decreasing, so therefore the testosterone also is going to decrease, and then both of them decrease at the same time. mood swings, even some insomnia issues, difficulty with sleep, and, lack of energy and lack of ability to really focus doing work. That was an issue. And also sexually, she was really not there. She's relatively young and still wants to remain intimate and with her partner. And now she was struggling with that a lot. And I'm sure that it must have affected her relationship with her partner.
So with intimacy, it was affected actually. Looking back at it, I would always want to hurry up and let's finish or was uninterested. My husband had a very high sex drive, and here it was me. It was like, okay, not today or not tonight or maybe tomorrow. I would either try to put it off or wanted to just rush through it.
And a lot of women think that what's really going to bring their desire back is by replacing estrogen. But in reality, what really will bring your libido back, as it was the case for my patient here, is the testosterone. Women need testosterone, and it alleviates many of the symptoms that she was struggling with.
Normally they say within the first 2 weeks of receiving your therapy is when you will start to feel an improvement. Well, I can tell you right away within the first week of my therapy, I started to feel, improvement in symptoms. And the first symptom was the brain fog. Like I woke up one day and just like everything was clear. Like I had an organized thought process to say, I can do this today, I can do that today. I was more organized, I was more focused. Then as time went on, the energy started to come. I started to feel an improvement in my depressed symptoms. I wanted to talk more. I felt like nothing could bother me. My sex drive even increased. My husband didn't even know it, but here it is. I'm just like, okay, hey, it's that time now, versus before I would be running away from him.
Partners really appreciate the difference, and they really enjoy seeing that their partner really engaging in more sexual activity and initiating more sexual activity and enjoying the sexual activity. And because of all that, many of these women enjoy much better orgasms because they're more aroused and they have less discomfort doing sexual activity, particularly if you replace the estrogen. Now, one important thing is some women might be a little hesitant to take estrogen orally. But if they are, it is possible to use, for instance, a vaginal cream, which has estrogen in it, and the woman can place it inside of the vagina, and that will give them tremendous improvement with respect to lubrication, with respect to rendering the vaginal tissues more healthy. And I think that these are alternatives that women should know. This particular patient enjoys the systemic therapy, and she has opted for pellet therapy, which is a great option, the pellet therapy, because you don't have to remember to take, let's say, a testosterone patch or a testosterone shot, a testosterone injection. So the pellets, they're about the size of a grain of rice, and you can do a minor office procedure using a big, what's called a trocar needle. It's a big needle. After they numb the skin, they introduce the trocar under the fat, and it's possible to introduce the hormone under the fat, and then that in turns Now, slowly over a period of time, gets released. And so it's a tremendous advance in able to perform hormonal replacement therapy to be able to do what we call pellet therapy.
So opening up to my treatment plan, it's every 12 weeks. I do not go longer than 12 weeks. I come in, I have my labs drawn, they come back, they tell Dr. Gousse my levels, he prescribes the dosage for me. The actual procedure itself is 15, 20 minutes. I'm in and out of the door.
The important thing is there's no scientific evidence that would indicate that testosterone has any significant adverse effects in women when they replace it. And their life changes so drastically, particularly with respect to their level of energy, with respect to their emotional status. When you do these combination of hormonal replacement therapy, particularly when you replace both the estrogen and the testosterone in these women, a lot of issues goes away. I think that, in all honesty, I think there's an increased awareness of the benefits of hormonal therapy, which were not known before, which were not scientific evidence, were not readily available that much. Now there are more and more trials that are coming out, that coming from very good centers, from being published in very good journals, and people, quite honestly, have starting to witness when they do hormonal replacement therapy, the patients don't have many of the side effects that people were worried about, were concerned. So they're starting to utilize it. They're starting to utilize hormonal therapy, and they're seeing by far much more benefit than drawbacks. And particularly in women, there was a fear, or I shall say there's still some fear, that estrogen replacement therapy might be harmful in women, where it is almost impossible. In the majority of women, there's much more benefit than the possibility of harm. What happened was there was a former article that was published years ago that had indicated that these women are more predisposed to stroke, to heart attack, to adverse cardiovascular events. So because when this article was published, many clinicians really became very shy about replacing women's estrogen, although they were starving for it, they needed it. But it turns out that when they reviewed those studies, they realized many of these studies were flawed. There were statistical errors, there were the errors in the methodology of those clinical trials, so they refuted them. So the leaders in the field have come to realize there were errors in the conclusions of those studies. So because of that, they have revised the recommendation in terms of the safety of hormonal replacement therapy in women.
You know, a lot of times it's taboo to speak on how we feel about intimacy situations or how we feel about certain things, because people tend to normalize it, to say, hey, this is just who I am, this is just how I feel, not trying to explore their options to say, is there something wrong underlying, or should I be seeking attention for things like that? And a lot of healthcare providers are unaware, you know, that their patients may be going through that because they don't ask the right questions sometimes to get the patients to open up about these conversations or issues that one may be having. So if you're having symptoms, don't be ashamed. Open up to your provider. Explain to them what is happening to you. Let them do their assessment. Be okay and open with the treatment plan. You know, a lot of people have reservations about side effects, how things may affect you. But those are the conversations that you have with your provider so that they can educate you on updated literature about the treatment plan and overall how it will help you, because you do not have to walk around feeling a certain type of way when there's options to make you feel better.
So many of the symptoms of menopause persist for the rest of the woman's life. So menopause doesn't last 6 months or a year. It essentially lasts the entire remaining of the woman's life, in a sense, because they don't have the normal hormones that they had when everything was working fine. There is absolutely no reason to be fearful of hormonal replacement therapy. It has by far more benefits than side effects. It will change your life completely. I think Bethany gave a very compelling story about what testosterone replacement therapy has done for her. It's a very compelling story, and particularly with respect to her energy, her ability to focus, her production at work, and in the bedroom, in her sex life. And that for her has been a great enjoyment, and she feels good about herself. And again, I always give this analogy. When you don't have these hormones, those sex hormones, both in the male for testosterone and the female, that includes testosterone and estrogen, like you have the same room, but you cut off the electricity. So therefore, you're in the same room you used to be, but you don't feel you're living normally, right? You cut the electricity, the refrigerator is not working, the microwave is not working, the TV is not working, but you're in the same room. So nothing is working in your body, but you're still there. And all of a sudden, what testosterone replacement therapy does, it replugs the room. And all of a sudden, just the testosterone that fixes the television, it fixes the microwave, it fixes the electricity. You have light, you have microwave, you have television, you have AC, you have internet, everything works. And this is what hormonal replacement therapy is all about. You take the hormonal therapy, your sex life changes, your mood changes, your energy changes, your safety changes. I mean, there's so many benefits that you get at once by doing one thing, which is testosterone or estrogen replacement therapy.
When I tell you that the treatment changed my life and I would not go back for anything in the world, it's been now 3 years, and I've had other doctors ask me why I'm doing it, and I live by it, I speak by it, and I recommend it to anyone that wants to improve their overall health and their feelings of, just feeling like I can't do it.
And it's worth it.
And it is worth it. Absolutely 100% worth it.